Thank you very much. It's a pleasure to be here, and it's really an honor to be on this stage with such wonderful speakers. I think I've been here from the beginning. I've learned so many different things here today. Can you hear me okay? Okay, good, thank you. I'm American. I tend to speak fast. I'm half Italian, so that half of me that talks fast is the Italian part, just so you know. So I want to talk to you today about something that's very dear to me and to many of you in the audience. What is the quality of life for someone who survives a brain tumor, who is a child? And so because it's Liverpool, and because the Beatles are a part of Liverpool, and because when I thought about this talk, it really is a long and winding road that you're all on, I decided to make that the title of my talk. We're going to talk about quality of life and late effects. So I want to give you a general overview of some of the late effects that you might experience, and then how to achieve the best health outcome for your children. So how can you yourself achieve the best outcome if you had a brain tumor or for your child? And then provide resources for you and for your children, and also to talk about hope. There's hope that a lot of these symptoms can be managed, and hope that the symptoms can be maybe not never to begin in the first place as more new modalities come into place. So I chose this picture of the brain because the brain is beautiful. You have beautiful brains. Your brains have gone through trauma, but your brain is still beautiful. And I wanted to show you that because that's a lovely picture of a brain. And never forget that. Pediatric brain tumors are the most common solid tumor, as you already know. The survival rate is improving, which is incredible. And I've been doing this for a number of years and had to see the survival rate and cure rate over time. Because of that, there's a growing population of survivors. There's more of you out there, which is great. And so we need to know more about how to help you take care of yourself. And so there's also increasing information on the unique health needs of the childhood cancer survivor. It's a unique population. So what are late effects? Late effects are complications that can begin or continue after diagnosis. They can be a result of actually having the tumor. It can be a result of hydrocephalus. It can be a result of the treatment that is given, whether that treatment is surgery, radiation, chemotherapy, or all of the above. Childhood is the time of greatest brain development. Think about your toddlers when they were just starting to walk and how they're running now. Think about the brain development from learning to say their first words to telling you maybe not so much telling you, maybe texting you now, how they feel about something. So the brain development is such a wonderful thing, and it happens during childhood. And so that makes these kids most vulnerable, because this is happening to them at the most vulnerable time of their brain development. So the late effects are divided into different types. Neurocognitive is how we think. Endocrine is the hormone system. Neurologic or sensory. We also have cerebral and cardiovascular, so blood and brain and heart, blood vessels. Second, malignancies. These are malignancies that are caused by the cancer. And then psychological and social, how we feel, or what's our emotional health, how do we engage and relate to others. So how common are all these late effects? So the Childhood Cancer Survivor Study did a self-report. By self-report, they're thought to be about 62% said they had one effect, and 33 had three or more, and that there was a portion of them, 1/3, were thought to be life-threatening or severe. Now this was by self-report, so it may underestimate what it really is. And Melissa Hudson at St. Jude Hospital did a medical assessment of 1,700 childhood cancer survivors, and they felt that by the chance of having one effect by age 45 was high. The chance of having disabling or life-threatening condition was 80% by the same age. All these slides will be available to you so you can see those references if you like. So what are the risk factors? Where the tumor is located, increased doses of radiation therapy and chemotherapy, young age. Young age is important. Treatment effects are additive. The more types of treatment that you or your child has, the more risk you have for having side effects. And also higher doses of those treatments can also be additive too. The developing brain is more vulnerable, so the burden is greater for children who have brain tumors than for children with other kinds of cancers. So neurocognitive, these effects can range from mild to severe. And one way of measuring it, it's not ideal, but it's a way of measuring it, is looking at IQ. And there's a number of studies that show that there's a decline in IQ of 12 to 14 points, and that decline may be progressive over time. So what is really affected when they're looking at this? It's something called executive function. So executive function, a good example is I had to pack to come to this trip. I live in Madison, Wisconsin, so I had to pack my suitcase to get ready for this trip. That involved planning. I had to think about what was the weather going to be like? What did I need? How many days was I going to be here? And making sure they had all those things together. And that's broken into attention, working memory, and processing speed. Despite my efforts, I still forgot a couple things. So none of us are perfect. So it's felt to be the reason why school performance is not good for some of these children, and why you see IQ decline. It's thought to be those areas. So what is neurocognitive? It doesn't mean, as one of the speakers said, that you're going to forget things you've learned. You just are not going to learn at the same rate as your other peers. So you're not forgetting learned material, but you're not achieving the normal age-related gains. As children grow, their IQ goes up because they learn things, and they're able to do that. So you're not able to keep up and learn at the same rate as other children that age. So what are the risk factors? Again, you'll see a theme here: younger age, increased radiation field, increased radiation dose, and then and then also longer time from treatment, and tumor location. Also, being female is a risk factor, but the ones that are starred are the ones that are thought to be the most important. So let's talk a little about neurocognitive and radiation therapy. Radiation therapy is important and is curative, but it has some side effects. So giving whole brain or craniospondyle radiation causes more problems than focal radiation. And again, younger age is a greater risk. So the younger you are, the radiation is more difficult. So those age 3 and under has profound effects. But even those who are, age 6 or older, there also are increased deficits with that. And really, there's no safe age. Adults who have whole brain radiation do have deficits. So there's really no safe age. So there's some conflicting information, though, on the dose. So is it related to whether the boost is given to the back of the brain, or just the boost to the tumor in the back of the brain? There was an article recently published 2 years ago that talked a little bit about that. What about chemotherapy? So being a pediatric oncologist, that's what I do. And so there's less clear role of chemotherapy. And usually chemotherapy, when given for children with brain tumors, it's not just one agent. It's typically multiple agents. So you have that option. You have that going on also. The problems related to chemotherapy are thought to be less severe and may be limited to attention and visual processing and visual motor function. So what is visual motor function? You have to copy down a homework assignment that's listed on the blackboard. And so you can see it, and you write it, but you're slow, and so you can't get it done in time. And so you may find that's what visual motor function, one example of that. There's something called the posterior fossa syndrome, and it can be seen in up to 29% of children who undergo surgery in the area of the cerebellum, the back of the brain. And the symptoms can be a number of symptoms. You can have loss of speech, which is also called cerebellum mutism disorder, decreased muscle tone and balance problems, have difficulty walking, problems with attention, your working memory is not good, you may have problems with how fluent your speech is. You also may have problems with executive function. These symptoms can persist for years. So this also is another thought to play a role in the neurocognitive profile that you might see in a child treated with a brain tumor if that child has that. So another beautiful brain. This one is made out of flowers. But how does this impact the person? We talked about a lot of numbers. What does this mean? It means it may affect that child's ability to live independently. They may not be able to drive a car based on what their profile looks like. They may have problems completing their education. They may have difficulty finding a job. So those are important things because these are things that are of value and worth to people. So what can you do? It's one thing to know about what the problems are, but what can you do? Are there things you can do to avoid those problems? So there are educational interventions and special education, so the school system can be really helpful in working with you or your child. There are some cognitive training programs. They have shown some improvement in IQ, but not school performance. But there's still ongoing research, and Dr. Kajar mentioned earlier that there's some ongoing study at St. Jude to look at some of these things. There's a computerized cognitive training. There's some preliminary information that was published in the Journal of Clinical Oncology. And so it's preliminary, but I think people are looking at these more and more to see if they can make a difference. Since you have to have the radiation, there's something you can do to help the problems that are caused by that. So what else can be done? Use of stimulants. ADHD or attention deficit hyperactivity disorder. Ritalin or methylphenidate is the other name, is one that's used. It helps improve attention. It may help processing speed in some children, and there's been published information that it may be helpful. Also, modafinil is something that's used in patients of Alzheimer's. So there's currently a Children's Oncology Group study that's ongoing looking at the role of modafinil on those patients who are undergoing treatment. So obviously there's no results because it's an ongoing study. Donepezil is another another agent that's used in patients with Alzheimer's disease. And there was a clinical trial that ended. They had small patient series, and they did say they needed a larger randomized trial to see if that can be helpful. So there may be more coming along those lines. So I want to switch now from the brain to the endocrine late effects and the endocrine system, or hormonal system. So the most common hormone deficit that you're going to see if you have it is growth hormone. That is the most sensitive hormone to late effects. And you need growth hormone not just to be your full growth, but you need it for your bone health and you need it for your metabolism. So people who are growth hormone deficient have other problems, not just they may be shorter than they would have been. Also, the radiation to the hypothalamus is the biggest factor. So the hypothalamus, pituitary area, that is the area where the growth hormone, that's where the hormone can be damaged. The thyroid hormone, the thyroid gland is in your neck, and that helps with your metabolism and your sense of energy. If you have poor thyroid function, you may not grow as well, you may have decreased energy, you may not do as well in school because you don't have energy and you may be fatigued. And so the main damage that occurs to the thyroid gland is if you have cradiospinal irradiation, so spinal radiation where you have the exit beam that is to the thyroid area. So reproductive health. Reproductive health is very important, and we know that some of these treatments that are given to cure yourself or these children can cause problems with infertility. You can have precocious, so puberty starts way too early, or delayed puberty, and those can all be side effects of the treatment. A little bit more about some other endocrine late effects. So the hypothalamus, pituitary, adrenal, kind of focusing on those three. So if you have ACTH deficiency, that's something that you don't see for many years later. So that can happen 15 or more years later after the treatment. So something that can be late. And so some of the symptoms of that can be loss of appetite, anorexia, decreased energy, low blood sugar, and poor weight gain. So it's important to kind of be thinking about that. So obesity is something that's seen in childhood cancer survivors, including children with brain tumors, and hypothalamic obesity. So there's an increased risk of obesity, and you also have problems with increased lipid problems, and you also have problems with your insulin. You don't manage your insulin as well, so your blood sugar is elevated. So you have decreased insulin response. So this is something that can be seen. Growth hormone deficiency can also play a role. These can all be seen together. And you can also have hypothalamic obesity if you have a tumor in the hypothalamus or radiation in that area. That can give you a sense of, you're not going to keep eating because you're full. So if you upset that, then you're going to have problems with that, and that's a difficult situation. And so it's really important that if you've had some of these risk factors, that you make sure that you're looking for blood sugar problems. Are you looking for lipid problems? Are you making sure that the person is healthy and trying to treat those as much as possible? There can also be neurologic or sensory late effects that can occur depending on what the treatment was. And these can occur, most commonly hear about hearing loss, and that can be because of the agent cisplatin is one of them, or radiation. And the earlier speaker this morning talked about how they try to really be careful to make sure the radiation beam avoids the cochleus. Also, balance problems can occur. Some of that can be from the tumor itself or from some of the treatments. And also generalized weakness can be one side of the body or overall. You can also get peripheral nerve damage, and that can be seen in these agents, cisplatin, vincristine, and vinblastine. And this is important because you can have something that's called foot drop, where you don't pick up your feet all the way, you have foot slapping when you walk, and that can lead to muscle weakness. And if you have muscle weakness, then you don't move. If you don't move, then you gain weight. If you gain weight, then you have obesity and other issues. It's all this kind of continuum. So it's really important to make sure that you're taking care of these things as best as possible. In our Caring for Life clinic, which is for our childhood cancer survivors, we actually have a pediatric physical therapist there, and she picks up a lot of these problems early on, and then there's something you can do about it. So being aware of it is really important. So if anything that affects your physical activity or decreases your ability to be physically active can also lead to obesity. So what kind of effects does it have on the blood vessels in the brain and blood vessels in the heart? So cardiovascular disease is the third most common cause of mortality or death in survivors. So this can be a result of damage to the brain blood vessels and also blood vessels in the heart. This can be manifested as stroke. There's increased risk of stroke, or it can be large or small vessel damage in the brain. Also, cardiovascular effects can be heart attacks can be seen, congestive heart failure, problems with having abnormal rhythm, and also heart valve problems. So you can decrease the risk of stroke by preventing obesity, and by taking care of diabetes, if that's the problem, and taking care of any lipid problems. So there's things that you can do to modify some of these risks. Second, malignancies. A malignancy, because of the cancer treatment, is the second most common cause of death in survivors. It's a leading cause of death greater than 10 years from treatment. It accounts for about 5 to 10% of all the cancers in the United States. And what you can see is certain chemotherapy agents can predispose to leukemia. Radiation can predispose to solid tumors or tumors in the skin in the area of radiation. And the most common tumors are gliomas and meningiomas. So you can see sarcomas, and you can also see thyroid cancer can also be found. So what about psychological and social problems? So pediatric brain tumor survivors have the worst health-related and psychological outcomes compared to other childhood cancer survivors. They do have higher rates of depression, distress, and a lower health-related quality of life. And what are the risk factors? The risk factors are being female, being in poor physical health, and having a lower socioeconomic status. That's the same risk factors for anyone having those things, so not just having a cancer in your background. So what happens, though, if you have these things ongoing, then these are risk factors for risky behaviors, such as overeating, such as smoking, such as alcohol. And so these are risky behaviors that also add to the problems that you can face as a survivor. So trying to make sure that people are holistically healthy as they can be is really important. So what can you do? Now you've heard a little bit about what some of the long-term side effects are. You can obtain a survivor care plan. This would include a treatment summary. What was your diagnosis? What was your treatment? What was the radiation? How many gray? What was the dose of radiation? Where was the radiation? What was the chemotherapy agents that you or your child received? So that's something that can be created. It outlines the recommended surveillance for kind of looking for these late effects. And these guidelines should be based on long-term follow-up guidelines. And there's Children's Oncology Group is one example of one. So as a survivor, you and your family should advocate to have these long-term follow-up guidelines so you know what you might be at risk for. Because as we tell many of our patients at our clinic, you cannot always tell that they had childhood cancer. And so it's really up to them when they become older and they're on their own, seeking their own health care, that they are able to educate their provider that, hey, I'm at risk for this because of this exposure. So how can you improve your child's quality of life? It's something that all of you want to do. You can really try to address any physical and emotional issues as best as possible. Work with your child's school. Work with your school team to help them understand his issues. Enlist your care team for help. There's always a lot of people who can help. It's just a matter of asking. So have those people help you and help your child in the school system. You can obtain a neuropsychological assessment. It's a usually 4 or 5 hour testing that really looks at how your brain functions. What do you do well? What are things that you need more help with? And it's really important to know that, especially if you had a history of radiation to the brain, if you've had hydrocephalus, if you've had posterior fossa syndrome. You should be aware of the potential psychological distress in yourself, your partner, and your other children. So a lot of time the focus can be on the child who's undergoing the treatment, but as you can all tell me, it really is a family event. So making sure you're trying to take the best care of everybody as possible, including the other siblings. So what can you also do to help your child? This is a heart that's made up of vegetables and fruits, so I guess you know where I'm going here. Eat your fruits and vegetables. Promote healthy habits in your home, including good nutrition and physical activity. If you have lipid problems, or your child does, make sure they get treated. If there's high blood pressure, make sure that gets treated. Those are all risk factors that can be harmful. If there's diabetes in the family or in the child, make sure that gets treated. These are ways to keep your heart and brain as healthy as you can. It's really important to promote social interactions. There might be special camps, there may be support groups, meeting other survivors. I think of the group of survivors that I take care of, the ones who have brain tumors and who had cranial spinal radiation. Those are the ones where they don't feel like there's anyone else like them, but that's not true. It's just a matter of connecting and making those connections. So as much as you can do to support those social interactions are really important. And then continue to educate yourselves, such as coming to conferences. These resources will be available online, and there's also a research page outside. This article here is Late Effects of Treatment of Pediatric Central Nervous System Tumors is a wonderful article that was just published just in January 2016. So all these articles will be available to you. You don't have to write all those down. And so we start out by talking about this talk being the long and winding road. So the journey starts with a diagnosis, and then it may include treatment, possibly retreatment. The survivor care plan is your roadmap, or I guess GPS is a better term to use now than roadmap. Stop along the way and ask for help. There are many people who you've heard from today that are willing to help. And you know, this journey, like one of the other mothers said, is not something you chose. You didn't choose this journey. Your child didn't choose it for sure. And so there may be obstacles in your way. And I really hope, all of us hope, that you end up in a place of the best physical and emotional health for you, your child, and the rest of your family. And this is the city that I live in, Madison, Wisconsin, and that's our waterfront. We have 3 lakes, and that's our capital. So thank you so much for your kind attention.